It's nice to see some new people today, and some new people and some people who I know already. Welcome back. I see a lot of my existing clients here, which is so nice to see you guys and for you to take advantage of listening this new material that I'm about to present and about hypertension. I would like to present today some very, very important topic of elevated blood pressure or hypertension, which affects so many people all over the world, not just in America, not just in New York City, not just in my practice, but everywhere in the world. So this silent epidemic or pandemic, I should say, the word that's more familiar now, is really affecting so many of us and our family members. And I would like to share some natural approaches and notions behind the hypertension. And the first statement that I want to make, and it's a pretty bold statement, is that hypertension is actually not the disease. In conventional medicine, we put it into the disease and diagnosis, but it's actually an effect. It's effect of the body appropriately to respond to a certain insult. And so in this lecture, we're going to talk briefly about what is high blood pressure, what are the risks of the hypertension, how does one develop the high blood pressure, and what are the common mistakes when we are measuring blood pressure, because the technique is really important. What are the treatment options, conventional as well as their functional medicine or naturopathic approach. And we'll talk about the cardiovascular program that we offer to our patients. So what is the high blood pressure? Obviously, it's related to circulation, and circulation system impacts all other systems in our body. It affects immune function, it affects gastrointestinal health, cardiovascular health, of course, and even the musculoskeletal function. And anything that causes the blood vessels to constrict will increase the blood pressure. So blood pressure is not just their symptoms, it's an effect due to their underlying cause. And those causes could be listed right here. So could be stress, emotional or physical stress, psychological stress. It's a variety of the toxic substances, alcohol or caffeine or certain medications, or even toxins in the body, or accumulation of their metabolic waste in the body. The dehydration can actually cause the constrictions of the vessels and therefore hypertension as well. And sleep apnea or sleep disorders, which is also goes undiagnosed for so many of us. So what is the risk of hypertension? It turned out to be that 50% of adults in the United States suffer from elevated blood pressure. And only 1 out of 4 have their hypertension under control, which means that 3 people out of 4 actually have walking around with uncontrolled blood pressure. No matter how many pills they take, if they don't resolve that underlying cause, the blood pressure will remain elevated. So it's a great potential for us functional medicine doctors to teach our patients how to control the blood pressure in a more natural way. So as we all know, their hypertension itself is not a problem, but that elevated blood pressure can little by little damage the vessels, promote the atherosclerosis or the process of the plaque building in their arteries, and eventually end up with a higher risk of the heart disease, myocardial infarction, as well as strokes. And those are obviously a top leading causes of death in the United States, as well as the very costly complications of the elevated blood pressure. So needless to say, if you have a high blood pressure, you must address it. You can't just say, oh, it's okay, I can handle it. We need to treat it and treat it in a multifactorial way, not just with the medications, but also resolving the underlying cause that's causing the blood pressure. And it's different for everyone. However, there's an infinite insult that will be categorized in 4 most common reasons why the blood pressure goes up. First is mental and emotional stress. Sleep disturbances, sleep apnea is being one of them. Blood sugar imbalances will increase the blood pressure and constriction of the blood vessels, and general inflammation, and that notorious inflammation that causes aging, causes joint pain, and also causes the elevated blood pressure. So whatever insult is, it will cause the abnormal vascular response in the body and vascular constriction. And that vascular constriction will increase the blood pressure that we measure when you come for your physical with your primary care doctor, or even when you come to my office and I check your blood pressure. So let's talk about each of those factors and how they affect and why are they affecting our blood vessel tone. So let's start with the mental emotional stress, which is so common for all of us. So when the brain receives the signal about the stress, it responds in a different way. One of the way brain responds is by increasing this cortisol, adaptogenic hormone that helps us to adapt to the environment. As a result, we get this heightened awareness. We get our blood sugar increased. We get the rapid pulse. As a result, increase our blood pressure. At the same time, if we run on the high cortisol for a long period of time, we lose our immune defenses. So high cortisol will decrease our immune defense and will decrease our digestion, because when we are in stress, we're not about to sit down and have and digest our meal. So all those factors will increase the cortisol and will cause the elevated blood pressure. At the same time, when our brain perceives the stress, it also will respond with another very important neurotransmitter and mediator, epinephrine or adrenaline. And we all know that expression of the adrenaline rush, right? Our body is prepared to deal with the danger, that fight or flight response. So we increase our heart rate, we start breathing rapidly, we are in the state of exaggerated fear or anxiety. So guess what? Majority of us are walking in this stress, in the state of the fight or flight, majority of our day. And body little by little resets, and it becomes new normal for the body to stay in that escalated level of stress, which is eventually will lead to the elevated blood pressure. So sleep apnea is another very, very important factor that will affect our blood pressure. And we probably all know this is basically a moment when we stop breathing at night. For many of us, it goes undiagnosed and unconscious. Only if our partner tells us that, oh, you stop breathing, or your breathing becomes erratic at night, and you are not, or you have a long pause between your breathing. But what are the signs and symptoms of possible sleep apnea? So morning headaches, morning fatigue, people with the usually large neck size are much more prone to sleep apnea. People who are overweight will also have a higher risk of sleep apnea. Excessive daytime sleepiness. Those of us who have a luxury to sleep 7, 8 hours and still get sleepy as soon as they sit down in the bus or in the train, and they feel like they can fall asleep or can take a nap. Nighttime gasping, choking, or coughing. Sometimes even gastroesophageal reflux or GERD could be one of their hints that can help us to suspect sleep apnea. And of course, the irregular breathing during the sleep. Turn out to be that 1 out of 5 adults will have a mild sleep apnea, which can progress to the more moderate and severe, which statistically goes 1 out of 15 Americans might have a moderate to severe sleep apnea. So unfortunately, 75% of severe sleep disorders, sleep apnea cases will remain undiagnosed. So that's why it's so important to rule it out and address it with a variety of means. You don't have to necessarily have a CPAP machine, which is cumbersome and difficult to manage and may lead to many other problems. There are some orthodontic devices now that can be intraoral devices that can help to keep your airways open during the night. So something that you can address either with me or with your dentist. So estimated that up to 85% of patients with high blood pressure do have a sleep apnea. And how can we increase the oxygenation of the blood? This is their little small piece of equipment that actually approved by FDA to lower the blood pressure naturally. It's called Respirate. It's a very simple device to use. All you need is 10 minutes of practicing in the morning and at night to retrain your brain and your breathing to improve your oxygenation of the brain. And as a result, you actually have a lower blood pressure. So something that you can access or purchase in e-store, in my e-store. And I will give you their discount code for that. So the next factor that is really commonly overseen in patients with newly diagnosed hypertension or elevated blood pressure is the sugar dysregulation. And it could be very mild, or it could be even on the level of diabetes that will affect the persistent elevation of blood pressure. So what causes this blood sugar fluctuation? Skipping meals or relying on highly processed meals will lead to the blood sugar swings. So the blood sugar will cause the cortisol release, and we already talked about cortisol, that how it participates in the blood vessel constriction. And cortisol will compensate by increasing the blood sugar, causing the release of insulin. The next net result of this problem is that high insulin and high blood sugar and high cortisol will all increase the blood pressure. So it's very common that when we control the blood sugar fluctuation in my patient, the blood pressure normalizes because they're not in that roller coaster of cortisol, insulin, sugar. So eating regular meals, low sugar meals, less processed food, more whole foods are really, really important. And then a few words about the chronic inflammation. As you know, inflammation is a good thing. It's your immune response of your immune system for defense and repair. And that's what happens in our body all the time in the form of acute inflammation, as you can see in this slide. So inflammation, for example, when you sprain an ankle or you have a cut or you have a burn, the body will respond with acute inflammation. And by the day 30, that acute inflammation should be resolved. Unfortunately, for many of us, we live in the state of this chronic inflammation when inflammatory resolution phase of inflammation never really take place. So we just accumulate this inflammation over and over for years, and that will create this chronic indwelling inflammation. So depending on how long the trigger of the inflammation lasts, inflammation can be either acute or chronic, as I said, and if unaddressed, that chronic inflammation will ultimately damage the vascular lining and promote vascular constriction, elevated blood pressure, and all consequential steps that will lead the damage of the vessels and promotion of chronic inflammation. So if these insults are present, the body needs to compensate by increasing the blood pressure. And insults that we just discussed, the blood sugar, the inflammation, the sleep apnea, and the sugar dysregulation. So that will cause the abnormal vascular response and vascular constriction, and as a result, will have their elevated blood pressure. And please don't forget about the water. The viscosity of the blood is also another very important factor in the blood pressure control. If the blood is very thick and viscous, it sticks to the blood vessels. And the thicker the blood, the harder the job for the heart to pump that blood through their vessels. So don't forget to drink plenty of water, how much to drink. For elderly people, with already compromised cardiovascular system, I would say 8 glasses of water per day is definitely enough. And that would include also their water that they take with their soups or with their other beverages like herbal tea or protein shake that they mix with the water. But water is extremely important for their blood viscosity or thickness. But for younger people who are still who are not suffering from cardiovascular disease, half of the body weight in ounces is what we need to drink. So if you want someone weighs 150 pounds, 75 ounces of water per day is the important amount. And I do recommend for all my patients to start the day with a 2, 3 glasses of water. Start with one, then next week increase it to two, and then the week after increase it to 3 glasses of water per day before you drink your coffee or before you eat your breakfast or consume your protein shakes. So in order to improve the circulation, there's a variety of the technologies on the market. We utilize this amazing and unique piece of technology that improves the circulation. It's called VEMR, Pulse Electromagnetic Field Therapy device that can be used in the office and at home. And it's FDA approved general wellness device that you can use to enhance the circulation up to 12 hours. It's only 8 minutes session, and you can come to the office and experience it. And then for 12 hours afterwards, your circulation is actually improved. I will leave you this link that is here, and I'll post it maybe on your chat box later, so you can see, watch the video about this amazing device that will increase circulation. And as you increase the circulation, you bring oxygen, nutrients, and you, at the same time, you remove the waste products from peripheral tissue, and all of that will improve reduce the inflammation in the body and improve how you feel and how your blood pressure is controlled. So how should you measure the blood pressure? There are actually, majority of the people measure blood pressure incorrectly, my mother being one of them. So I always have to remind her that she cannot look at the screen with that automatic machine to measure blood pressure. So first of all, always measure your blood pressure after you sit for 5 minutes. You rest, you relax, you breathe, you utilize that deep diaphragmatic breathing that your health coach can always teach you how to do, and have both of your feet on the ground. Make sure your arm where you place their cuff for the blood pressure measuring is at your chest or your heart level. Make sure you empty your bladder before you're measuring your blood pressure. It's amazing how just doing this simple technique, you'll notice that your blood pressure will normalize. So make sure you empty your bladder. We recommend not to consume any caffeine for up to 1 hour before measuring blood pressure, and no exercise for 30 minutes. So, and you should be sitting in the warm and relaxing environment. If you're in the cold room, obviously your body will respond with the vessel constriction. So think back, if in the last time you measured it, did you completed all those points? And if not, next time please consider those important measures before you do your blood pressure. So how do we treat blood pressure, elevated blood pressure? Of course, you're familiar with the traditional treatments. Obviously, there's a polypharmacy that is used broadly. Sometimes people come to me with 2, 3 medications. It could be diuretics, ACE inhibitors, ARBs, calcium channel blockers. And in general, generally doctors will say, well, just reduce your blood pressure, or your salt intake. And that's a general advice for everyone. Well, in functional medicine, we actually personalize the diet for people. Not everyone benefits from the low salt diet. Actually, about only 25% of people who have a specific gene that's called ACE gene deleted, who are very sensitive to salt, as well as to saturated fat, the fat that are in the animal products, that will respond with the elevated blood pressure to those foods. So in our approach, in functional medicine approach, we definitely personalize the dietary recommendation. We also recommend appropriate movement and exercise. Not everyone needs to run marathon in order to keep their blood pressure low. Not everybody needs the high impact exercises, but movement in general is extremely important, especially movement outside in the open air. Removing stressors. And we work very hard with our patients to teach them how we can remove those stressors that we just discussed. Is it emotional stress? Is it blood sugar dysregulation? Is it sleep apnea? Or is it just a general level of inflammation that is supported by either a chronic pathogens or chronic inflammation due to the musculoskeletal issues or autoimmune disorders? We need to address those in order for blood pressure to respond favorably. And of course, we're taking the deeper look into patients' individuality. We're looking at the oxidative stress, at the heavy metals accumulation. And of course, we do this genetic test that will give us understanding, is the elevation in blood pressure is something that is genetically predisposed for this person, and that's their vulnerability, or is it more environment driven? So that's a very important question for us to answer, and for the patient not to feel guilty that no matter what they do, the blood pressure is still elevated. If that's the genetic makeup that they live in, we're going to also counsel them accordingly and give them the recommendation. And so I want to briefly present this little case study of a patient of mine who's James, and he's a 52-year-old African-American man who recently was diagnosed with high blood pressure. He works in a kind of stressful environment because he's a middle to high level of banking, and he's a father of 2 teenage daughters, and he has some marital stress if he's going through a divorce. So he was offered 3 medications for his blood pressure and for high cholesterol labs after he was screened by his primary care doctor. But in spite of all those measures that he did, his blood pressure still remains elevated despite taking medications. And of course, he started experiencing all the unnecessary side effects in form of muscle cramps and excessive urination that wakes him up in the middle of the night, and now erectile dysfunction. So what can we offer to James? So we identify the upstream triggers. First of all, what are the problems for him, right? So we know that he has stress. When we did the stool test and we found that he has a severe imbalance of the microbiome with parasites, bacteria, and H. pylori. So we needed to address that because this is a main inflammatory factor that drives inflammation and drives the appropriate response of his vessels to their inflammation and to the insult. And he also found to have deficiencies in potassium and magnesium, and those are the 2 very important minerals that help our blood vessels to relax. So even if the initial response of the body to the stress will be vasoconstriction, but then if we have enough storage of the magnesium and potassium, body will quickly return to the balance and relax those constricted vessels. So we help to implement changes based on James' lifestyle. We provided him individualized diet. In his case, he had that ACE deleted gene, which is a salt sensitive gene. So we told him salt is your enemy, but not for everyone. How do we know? We need to check genetics. We need to see what are the genetic makeup in each individual case. So for him, I strongly recommended stay away from any sodium chloride or salt, sodium containing salt. So he needs to be on Mrs. Dash salt or use the spices to flavor his food. We also invited him to manage his stress better with the heart math group sessions. We'll talk about it a little bit more for those who didn't hear, who doesn't know about the heart math. And Beamer that I already presented to you. By the way, this is their code that you can plug and watch the presentation about Beamer that will explain how Beamer works and how you can benefit from it. And then, of course, we recommended some supplements which were structured in step-by-step process. We addressed the stress, a better sleep, dysbiosis, and corrected all the nutritional deficiencies. As an outcome, most individuals can naturally control their blood pressure by focusing on removing the various stressors that are causing hypertension. And medications can be used and should be used while those factors are addressed, but they're not life-centered. And at least we can do is to reduce the dosage of medication and the quantity of the medication that people take. So you are in the control of your cardiovascular health and your blood pressure. So we do offer the cardiovascular metabolic vital programs that will take you through the journey of initial visit with me or with another practitioner, our new practitioner who is also certified in functional medicine. We go through this extensive intake, then testing that we order individually for you. It usually includes conventional labs as well as the specialty labs like genetic testing or maybe stool testing. Some of the functional medicine labs will prescribe you lifestyle intervention as well as certain supplements. You work with a health coach to implement those changes, and we'll give you some resources for homework like heart math practicing or Beamer or Respirate. And then we'll meet you for the follow-up visit and follow-up testing. We also offer our patients the group visits. So if you can't work one-on-one with a health coach, on the monthly basis, we offer 1 hour with a health coach in the group of the patients who probably suffer from the same issues like you do. So it's a very good, affordable option for our patients to participate in group visits. So what's the next step? If you are my existing patient and you haven't seen me for a while, please call and schedule an appointment. If you're a new patient and interested to participate in this journey that I just outlined, feel free to call us and someone from my staff will walk you through the process. Sign up for our newsletter. We usually post a lot of interesting facts and educational materials for our patients, and you can follow me on Instagram as well. So now I would like to open the time for questions and answers. If you have any questions, feel free to either unmute yourself or you can type your questions in the chat box. And while you're thinking of the questions or you're typing them, I briefly want to remind you that we have a couple of interesting perks and events coming up. So on February 17th, which is in 2 Fridays, we're going to have another live question and answer session. And I will teach you of blood sugar regulation in a natural way. So it will be a similar format, a brief webinar, and then you'll be able to ask any questions. We always have those webinars on Friday at 4 p.m., at least twice a month. And also, I mentioned the heart math series, which is an amazing method of regulating your heart rate variability, which is a marker of longevity and health. So we teach our patients through their step-by-step process how you can regulate your heart rate variability and improve your mental and emotional resilience. It's a great self-regulatory skill of building the coherence between your heart and your mental and emotional health. It turned out to be the science actually shows that we are feeling with our heart and we're sensing the environment with our heart first, and then heart sends the signal to the brain. And this is totally new from what I learned in medical school in my physiology classes, and that's the new age research. And so we teach your heart to be much more resilient and much more perceptive and not to be bent by the external environment, and at the same time stay in the coherence with your mind. The beauty of heart math practice is when you are in the state of the coherence, which is the congruency of work between your heart and your mind, you actually influence people around you. So I invite everyone to participate in building the universal coherence and improve their universe vibration on a higher level. So we do run these programs at least every 6 weeks. The next group class for Heart Math series will be on March 8th, and it's taught by our Heart Math expert, Jenny Terry. She is also our health coach. Also, remember about the group coaching. I think there's one upcoming group coaching class that will help you to establish your health goals or maybe some other goals, and how to set up their attainable goals and how to follow up with those goals and accomplishing of those. So feel free to sign up. It's a great opportunity to work with the health coach on in the group setting. Also remember, for those of you who already done their genetic test with 3x4 laboratory genetic lab, we do run monthly group supports. It's a great way to look deeper into your genetic makeup and refresh your understanding of your strengths and vulnerabilities, and remind yourself what are the lifestyle changes, what are your best food that you need to eat to make your genes work better, and what are the supplements you might need to support those vulnerable pathways. So please sign up for their February 27th group coaching on 3x4 with Marina Kucher, who is our expert in 3x4 genetic labs. And thank you very much for joining our live Q&A today. And as a special gift and appreciation, please visit my e-commerce store, which is shop at drelenaKlimenko.com. You can also reach that website through my website. And today you can use this code February FabQA10 and get 10% off site-wide. And actually, you can order Respirate machine with a 10% off if you order it on that website. So that's a couple of announcements. And I see that we have a couple of questions already. Let me read those. So Julie is asking, how do you address the microbiome imbalance? Oh, well, we have multiple ways to address that, Julia. Thank you for your question. So gut obviously is the instrumental in how much inflammation we carry in our body. So we address it either with definitely always with food, definitely with nutraceutical products, with herbs, with supplements, and sometimes we need to use pharmaceuticals, especially if we're treating parasites. Sometimes we do need to use pharmaceutical medications. It's my least favorite, but we will decide on an individual basis what is the best approach for you. And for some people, pharmaceuticals is the best option, and for some people not. So that's how we address the microbiome, but we usually test unless I see the clear pattern of, let's say, yeast overgrowth. So I will suggest to treat it first before we test with their stool test, because it could be pricey. And thank you, Natalie, for your question. I missed the very beginning of the sleep apnea. Did you discuss solution? And what is the factor in my family? That is the factor in your family. Okay, so we didn't really discuss the solution because solution has to be addressed by a sleep apnea specialist and it should be diagnosed. But sleep apnea now is not as a cumbersome testing and treatment as it used to be. So I mentioned that there are some, first of all, you can do sleep study at the comfort of your home. So you can, the practitioner will give you a little device and you'll sleep with it, and it will record your not only oxygen level, but also your frequency of your respiration. And then the computer will analyze it and the diagnosis will be stated. Either it's a mild, moderate, or severe sleep apnea. And then the solution should be also provided by the practitioner who tests you. So if it's a very severe sleep apnea, then sleep, the CPAP machine might be the answer. And sometimes it is important and necessary to control blood pressure and also control resistant weight loss. So it becomes a very important factor. But there are new devices that intraoral devices that one can wear throughout the night, and it will help to keep the airway open and patent. So there's no obstruction to the airway. So, but we do have practitioners who we recommend to see for sleep apnea, to rule out sleep apnea. Will there be a recording? I think we're doing recording, and I'm not sure. I have to ask if we're going to stand there recording, but I'm sure we will. Yeah, if you registered and you requested, we'll send it to you. Can you put the link to your shop in the chat, please? Absolutely. It's shop. You just basically shop the Dr. Elena. Or you can go to my website and let me just quickly copy it. For some reason I cannot copy this link. And it's FabQA10. Is there discounted code? And you can use this link. So copy it from the chat. So if you want to see more information about Beamer. And for those of you who are my patients, you can always schedule and have a Beamer session in the office. For Access members, it's free. For other patients, we definitely offer a free option to try it. And then if you like to participate in or use those treatments on a regular basis, we can arrange it for you as well. Okay, so let me see if we have any other questions and the codes for the discounts. Okay, all right. Well, feel free to use these codes and the websites and the links. You can also visit my website at drelenaKlimenko.com. And from that website, you can go to the shop and see a lot of other information. So if you have any other questions, feel free to unmute yourself and ask, or feel free to type. I see some new names. Welcome to our twice a month live Q&A. We started a new format where now I do a little bit of education dedicated to a specific theme. This month is the February month of heart, month of the Valentines, right? And cardiovascular disease, and especially women cardiovascular disease that is unfortunately undiagnosed and unappreciated in the conventional medicine. So definitely all the women need to be screened for cardiovascular disease and understand the risk factors. Okay. Do you have any other questions, my dear audience? It's really nice to see everyone. I want to wish everyone a healthy weekend, a healthy February, and we'll see you in the office.